So let me ask you a question. How many medications do you think you need to memorize to pass the NCLEX? Hundreds, thousands? Here's the truth. The NCLEX does not test pharmacology the way nursing school teaches it. Okay. And if you try to memorize your way through pharmacology, you're going to feel overwhelmed, you're going to feel anxious, and you're going to be unsure on exam day. Like, what is important? Okay, so today I'm going to show you exactly how the NCLEX tests pharmacology safety and why safety beats memorization every time. Okay, now one of the biggest myths in nursing education is that pharmacology is about memorizing drug lists. It's impossible to do. Too many drugs. All righty. The NCLEX doesn't really care if you can recite a drug class. What it cares about is if this medication that you're about to give, is it safe? Is it safe to give to this patient right now? Okay, so yes, you're going to have to know drugs. If you think of drugs like metoprolol, yes, it's in a drug class, but it's not about, is this drug this or that? It's okay, how does this drug benefit this patient? And is it safe to give right now? Okay, because every pharmacology question is about patient safety, actually. It's a patient safety question in disguise. So when you see a medication question, the NCLEX is really trying to test your ability of recognizing dangerous drug cues, you know, trying to identify abnormal vital signs or labs. Do you hold this medication? Have you determined that it's unsafe? And do you hold the medication? You know, you want to protect your patient from harm. And that is what the NCLEX is trying to see if you can do. The NCLEX rewards safe nurses, not memorization. So if a medication can worsen the patient's condition, the correct answer always, well, not always, you never say always, but it's often to hold the medication. Because when you hold it, you can always give it later. But if you give it, you can't take it back. All righty. So, looking at safety, on focus areas, the NCLEX consistently focuses on four high yield safety areas: high alert meds, dangerous adverse effects, look-alike, sound-alike medications, and your lab values that signal don't give this. So, if you really can master these areas, pharmacology becomes very predictable. You have to understand, and I'm going to say it again. NCLEX does not care about the class, what class this drug is in. They care about, is it safe? Is it safe to give to your patient right now? So that's why we talk about vital signs when you're in clinical. That's why we talk about looking up the labs. That's why we say look at those trends. A lot of students think, oh, that's just busy work. That's busy work. No, it's not. You need these tools to know if you're giving your patient, that drug that it needs, or do you need to hold it? Okay. So let's talk about the traps, right? These are traps that always mess up students. They give blood pressure medicines when the blood pressure is already low. They give opioids when the respiratory rate is already unsafe. Patient's respiratory rate is 10. The family member sitting at the bedside fussing at you saying they're in pain, but you're looking at the patient's respiratory rate. It's already 10. So if you give more, that's going to make it 8 or 6. And then you have a problem. You're going to be calling a rapid response, okay? You're giving potassium when the potassium is already elevated. That's why you look at the labs. You're going to put that person in a cardiac arrest, and then you're ignoring kidney function. Why you need to look at kidney function? Because if the kidney function is poor, then the patient is going to build up on that drug and they're going to become toxic. You do not want that to happen. These aren't tricks. These are safety checks. Can you recognize a safety check? Okay. So a simple, repeatable process that you can use. Identify the most dangerous cue. Check those vitals. Check those labs. And then decide, do I give this medicine or do I hold it? And then you want to always perform an intervention before calling the provider. If something's unsafe, you don't give it, even if it's ordered. Doctors make mistakes. Pharmacists make mistakes. People make mistakes. You are the last line to the patient. If it's unsafe, hold it. So let's just do something. This is kind of classic. It's easy, but this is what we're talking about. Patient's heart rate is 54. Metoprolol is ordered. What's dangerous? Bradycardia. What you gonna do? You're gonna hold the medicine. You're gonna give it because the doctor ordered it and it's gonna make the heart rate lower. Then you're gonna have a problem. Okay. This is not memorization. This is pharmacology safety. Okay. So that's what I'm going to be doing in this series. In this series, I'm going to help you stop memorizing endlessly. Start thinking like a safe nurse. Recognize danger faster, and choose the correct action, and be confident about it. This works through all areas: med surge, OB, peds, psych. So this is what this series is going to do for you and help you. So come to NurseEdScholar.com. I'm working on a pharmacology safety workbook. Just keep checking. I'm going to put it up real soon. And that's going to help you practice NCLEX style medication scenarios. Okay. Subscribe, please. Like and subscribe. Um, my goal is always to post a new series or a new video on Mondays. Sometimes I may be able to do a second during the week, but definitely on Mondays, because my goal is to help you study smarter and test like a pro. Okay. And so I'm happy that you're here. Please come, like, and subscribe, and I'll see you next time on Nurse Ed Scholar.